Be'ezras Hashem, my goal with this information that I've gathered for you is to unscare you. When you have accurate facts, not fear-mongering, and you know how you can act to help your children, you can make good decisions based on facts, not on propaganda and fear. Many people are frightened by what they're hearing about measles in Eretz Yisrael. Since I've been fortunate enough to get to know a special person who's been extremely involved in helping the children there, I've been speaking to her many times over the last few months. Baruch Hashem, I have a lot of detailed information to share with you regarding the situation with the measles in Eretz Yisrael. I've also spoken with some of the parents of the murdered children. Yes, I said murdered, and soon you're going to see why. Here are the many very strange facts about the measles outbreak in Eretz Yisrael. Point 1. First of all, how did it start and what spread it? Last spring, the Israeli government claimed that there was a measles outbreak, and in May, they started a mass vaccination campaign, dafka, only in the frum communities. They're giving MMRV, which is 4 live viruses in one shot. They did not do a vaccine campaign among the non-religious. Another interesting tidbit is that a doctor inside the system, who cannot be named for fear of retribution, told us that the MMRV is not being given in the non-religious communities. So if a secular child does receive the measles shot, it is not the MMRV, the one that's being given to the Charedim. Wow, sounds like the Israeli government loves the Charedim so extra much. It's important to know that the MMRV is the vaccine that has now been disallowed in the United States for younger children because of its higher rate of adverse events. By August, the Ministry of Health had given more than 100,000 doses of measles vaccine in Eretz Yisrael. But rather than getting better, the more vaccines that were given, the worse the situation got. By August, many children were extremely sick. Eretz Yisrael is not the first place that a deadly outbreak of measles followed a mass vaccine campaign. The same thing happened in Samoa in 2019 under extremely suspicious circumstances, with dozens of people dying on the heels of a mass vaccination campaign there. You can read the details about it in an article on my Substack. The same thing happened in Texas last spring, with 2 children dying supposedly of measles, but I'll tell you the details about that soon, on the heels of a mass vaccine campaign there. Smaller outbreaks, without deaths, Baruch Hashem, have been documented in many other locations in the US and Canada on the heels of mass vaccine campaigns. Since the vaccine contains live weakened virus, which sheds, those who are vaccinated can be spreaders. Although the health authorities deny it, the proof is in the pudding. It was seen very, very, very openly in Eretz Yisrael now. They had classes in which 98% of the children were unvaccinated. Then, when one child would go and get the measles shot, in a little while, the rest of the class would come down with symptoms. Similarly, they had whole apartment buildings of unvaccinated families, and when one family would get vaccinated, very soon the rest of the building would get sick. So, who is causing the measles outbreak in Eretz Yisrael? Now we come to the second set of strange phenomena. What were the symptoms of this outbreak? For many of the children, the symptoms of this measles were not like ordinary measles, which the families who don't vaccinate know how to treat. Measles is an ordinary childhood disease for them, and they know very well how to treat it and how to get the kids through it, and it isn't that bad. But this was different. This was a measles that they describe as COVID and measles together plus more. They feel that it's a bioweapon because it is so very abnormal and severe. It went through various iterations. At one point, sick kids were getting seizures. Some of them. A couple of weeks later, nobody was getting seizures anymore. Kids who got sick at that time were getting a certain type of shortness of breath. And then, a couple of weeks later, people were getting a different type of shortness of breath instead. It kept changing. The strange symptoms included severe vomiting and severe diarrhea, leading to dehydration, and a strong tendency to develop shortness of breath and low oxygen, with an abnormally high amount of cases turning into pneumonia. Now, not everybody got this, but there were many children who got very sick. Some people just had normal measles. Some people got this ultra, measles COVID plus that was just completely not normal. I'm not trying to scare you by this, chas v'shalom. I'm just trying to show you that the propaganda that they're trying to tell everybody it has a lot of holes in it. So I'm trying to just tell you what the real story is, that this is not normal measles. There were other unheard of symptoms that some children had, such as bleeding from their nose or eyes. Now, when I heard that said to me, bioweapon. That's not measles. Many children had staphylococcus in their blood. A private doctor who saw hundreds of the children remarked that their lungs were just like COVID lungs. Okay, so please think about that. Think what this means. This is not regular measles. It's likely a bioweapon of some sort from a laboratory, as COVID was. Dr. Richard Bartlett, an emergency room doctor who treated many children in the Texas outbreak, confirmed that many of these abnormal symptoms were the same ones that they had faced in Texas last spring. Please, I'm not trying to scare you. That's not the point, is that it's chas v'shalom that you should go away from this freaked out and scared. That isn't the point. There is treatment, and all the children who did poorly were ones that did not get proper early treatment, and I'm going to tell you about the treatment, so please don't worry. Just be prepared and just know the facts. Many people ask whether vaccinated individuals also got sick. The answer is yes, definitely some, but we do not have enough data to understand the full picture. For example, while the severe cases we heard about were unvaccinated, an inside source, who cannot be named, stated that many vaccinated children also came into the hospital sick, but they were given a different antibiotic, so presumably they recovered. While the others who got the antibiotic given to the unvaccinated, some of those were the ones that Rahman al-San we heard about in a different way. And yes, some children whose parents chose to vaccinate them became very sick directly after the vaccine. Back in August, my friend already was personally aware of 4 children who got the full-blown severe measles illness after their measles vaccines and needed to be hospitalized. I was told of one baby who ended up in the ICU for several days after the measles vaccine, and another child who had to be put onto a respirator after the measles vaccine. It was reported that the neighborhoods populated almost entirely by unvaccinated children were places where people got the sickest, while unvaccinated children from mixed neighborhoods had mild cases. This reminds us of COVID, where certain places were particularly hard hit, such as from communities, and it reinforces our belief that there has been foul play and a targeting of certain particular communities to make them sick. A possible clue was something that happened Rosh Hashanah time in Yerushalayim. This was the week in which there was a sudden cluster of deaths. It was also the time that mysteriously the air quality index shot up from 30 the week before to the awful number of 200. That means that there was a huge amount of particulate matter in the air, which can make people very sick and give people severe respiratory problems. People also reported a chemical smell in the air. What was going on? I do not know. Another clue that this isn't just measles. My friend reported calls that she got about several vaccinated adults who became very sick with the same symptoms, this same mystery illness, which was being called measles in the children. These previously vaccinated adults got the same severe symptoms as the kids were getting, including a rash. My friend herself is vaccinated, and she got a rash on her hands and an ear infection. So, is this just measles, ordinary measles? It can't be. Point 3, the next set of disturbing points concerns the government response in terms of treatment. The Ministry of Health did not allow and does not allow the children to receive treatment outside of the hospital. This is very, very important to understand. The way that they acted was completely abnormal, cruel, and inhumane, absolutely wrong, and inexplicable. The doctors and clinics were instructed not to treat measles patients. Now, one of the clinics did try to open for measles treatment, and the government shut them down immediately. This resulted in a terrible situation in which parents had nowhere to bring sick children for help unless they were willing to risk the hospital, where Haredim know that they're targets, and it was clear to them that they were being targeted. So what does this mean? If a mother had a sick baby and she was worried about him, if she would go to the kupa, the doctor at some of the kupot would come out dressed in a white suit, like for COVID, like scary looking. Other places, other clinics, not dressed in a white suit, but in any case, not allowing the child to come in, only meeting them outside, not wanting to touch the child, having the mother put the pulse oximeter on the child, and then the verdict was always the same: go to the hospital. No treatment offered in the clinic. Sending everyone to the hospital created a few critical realities that you have to be aware of. Number one, it caused headlines. Hundreds of children hospitalized with measles, which is what the establishment wanted in order to promote the vaccine. So think about it. If the children could have been treated with IV and with nebulizer treatments and with antibiotics, and most children, and not have had to go to the hospital. But when the only treatment you offer is in the hospital, you automatically are going to create a huge propaganda that there is a severe and extremely frightening illness happening over here that is resulting in hundreds of hospitalizations. So that's number one. Number two, this action of the government of not allowing any treatment for sick children outside the hospital opened the door to deaths from hospital maltreatment, just like it did by COVID. Number three, not allowing treatment outside of the hospital opened the door to deaths from children who did not receive treatment in time because their parents kept their children home too long because they were afraid of what the hospital would do to the children, and they had what to be afraid of, but having no doctor to see their child ended badly. Hashem Yirachim. How is outlawing treatment an action of a caring government who wants to save children? It is not. Very, very, very much not. All the children who died were children who did not receive proper early treatment. Their deaths are on the government's head. We will discuss the effect of life-saving treatment at the end of this recording. Imagine, here in the United States, imagine a child sick with anything: flu, pneumonia, ear infection, strep, and unable to be seen at the pediatrician's office or in urgent care. Imagine calling the doctor and they say, "Flu? You have to go to the hospital. We're not treating the flu." Of course, hospitals will quickly fill with hundreds of children sick with the flu. Do you remember by COVID how there was no treatment offered outside the hospital? And they said, come in when you have trouble breathing? How did that end? That did not end well. Outlawing treatment outside the hospital setting is not a normal, logical, or humane response and tells us automatically that something is very wrong. This mahalach is guaranteed to produce deaths from lack of proper early treatment, even without foul play in the hospital. But there was foul play. 4 children died in the same ward of the same hospital. And now we come to point 4. What did happen to the children in the hospital? 4 children dying in the same ward of the same hospital, but in other hospitals, children were given better treatment and nobody died in those hospitals? What does that mean? At least some of the children who died had not received the correct antibiotics for their pneumonia, so their situation deteriorated drastically. You must know that this is their playbook. This is the exact same ploy that was documented in an investigation to have been used by hospitals in Texas last spring. 2 children in Texas were given the exact wrong antibiotics for their pneumonia. Each had a different type of pneumonia, and each were given opposite antibiotic from what they need, from what the protocol called for that the doctors should have done. And as their illness worsened, their treatment was not changed. Their deaths were called measles deaths. And of course, that was propaganda used to scare parents and promote the measles vaccine. Their cases were blasted all over the news, all over the place. 2 children died of measles in Texas, but it was false. Their cases were thoroughly investigated, and it was not measles that they died from. They died from improper treatment of pneumonia. It is severe medical negligence at best and planned murder at worst, but it's not measles death. As previously mentioned, but this is so important that it bears repeating, an inside source, who cannot be named because of fear of retribution, admitted that many vaccinated children also came into the hospital sick, but they are given a different antibiotic than the unvaccinated children. I've spoken by phone with relatives of some of the murdered children. The hospital where 4 children died on the same ward is the place where the doctor actually told one family whose child had survived much longer than he expected. It's not a miracle, it's a failure. That's what he told those parents. This is the hospital where, when a family called in a private doctor for a failing child, the advice was not followed of the private doctor, and the parents were prevented from transferring their child to another hospital. This is truly a place of murder. And then the results of this murder are used to promote vaccination. When the goal is clearly the vaccine, not the saving of lives, you have to ask why. Something is very, very, very wrong, just like by COVID. Okay, now what are the effective treatments? Dr. Richard Bartlett stresses the critical necessities to Be'ezras Hashem avoid trouble. You'll see that his recommendations are not the typical natural treatments. He found that the natural way was not adequate to treat this bioweapon sort of measles, and this was their experience in Eretz Yisrael also. Dr. Bartlett says to use budesonide nebulizer treatments immediately and regularly, often throughout the day if a child gets measles. These treatments ward off breathing trouble. They can be given every 2 hours and even to the smallest babies. The budesonide nebulizer interferes with the virus replicating and also stops the cytokine storm. It's life-saving. The point is not to start using the budesonide nebulizer treatments only when a person starts having breathing trouble or only when a person gets very sick. No. The idea is to use the budesonide nebulizer treatments immediately when a child starts having measles to prevent it from getting worse, to prevent it from getting to a point of difficulty and danger. The antibiotic of choice is clarithromycin, and Dr. Bartlett advises, based on what he's seen, that it should be started right away, not waiting until a person gets pneumonia. With this abnormal kind of measles, he advises starting antibiotic immediately when a child is diagnosed with measles. Azithromycin, Zithromax, may not be enough, so the antibiotic of choice is clarithromycin. Augmentin alone is more than likely not to work. So, if a person cannot get clarithromycin, then they can combine azithromycin and augmentin, but really try to get clarithromycin. Hydration is critical. If the child won't drink, they either the parents have to stand over them and keep on giving them at very frequent intervals, liquid and from a syringe in their mouth, or they're going to have to get IV, because dehydration is a killer, Rahman al-Itzlan, and one of the children who died at home because the child was sleeping, and the parents thought that he was just sleeping because of measles, and they didn't realize that he's dehydrated, and he passed away at home because of dehydration. So do not let your child sleep and not drink. Please make sure that you get fluid into them, whether it's through the mouth or by IV, if that you cannot give it through the mouth. Okay, now there is a special drink called Hydro Shot. It can be gotten on a website called H2Bev. Hydro Shot, Dr. Bartlett told us, it makes nitric acid in the blood and boosts oxygen levels, and it's extremely life-saving. So see if you can get that drink. Dr. Bartlett saw kids turn around overnight with the budesonide nebulizer treatments and the Hydro Shot drink. Of course, if the children actually had pneumonia, in Texas, then they, of course, needed the antibiotic also. But sometimes children were just very sick and dehydrated, and they got better just overnight with the budesonide and the Hydro Shot. IV hydration can also boost oxygen levels. So sometimes kids had low oxygen even without pneumonia, and the proper hydration boosted their oxygen levels. Dr. Bartlett said to keep fever down to prevent seizures, to use Zofran to control nausea, and Imodium to control diarrhea. I know it's a lot of medications and some people might be uncomfortable with them, but if it's needed to get kids through this safely, then that's what's needed. How to prevent severe illness to begin with. So both my friend and Dr. Bartlett have recommendations to be used in advance to prevent people from getting sick to begin with Hashem's help. Dr. Bartlett advises an iodine nose and throat spray, which is available at immunemist.com, and a budesonide nose spray. And these are both over the counter. You don't put them in the nose at the same time, but they should both be used daily. My friend in Eretz Yisrael has natural recommendations for prevention. These include a healthy diet, vitamins, and certain vitamins and special essential oils. And she made a recording with the details, which you can hear on this hotline. Dr. Bartlett also made a recording about treatment and about prevention, which you can hear on the hotline now as well. May Hashem help that this information, given with a sincere desire to help Klal Yisrael, should be a vehicle and a messenger for Hashem to send protection and healing to all his children. Besuros Tovos Bakarov.